and thank you for joining me for today's episode of Big Ideas in Eating Disorders. In this series, we hear from people in the field of eating disorders who share with us their professional and personal journeys, experiences, reflections, and big ideas that never quite get represented in this way in the standard scientific meetings and publications. I'm Kathy Pike, clinical psychologist and professor of psychology at Columbia University, and I'm the host of Big Ideas in Eating Disorders. I'm delighted to be joined today by Professor Yael Latzer from Israel. Dr. Latzer is professor and former dean of the School of Social Work at the Faculty of Social Welfare and Health Sciences at the University of Haifa, and research director and founder and former director of the Eating Disorders Institution, Psychiatric Division, Rambam Healthcare Campus in Haifa, in Israel. Yael, I'm delighted to have you join us today.
Oh, it's my honor and pleasure to be part of this amazing project.
Thank you. So let's start at the beginning. Where did you grow up, and when did you get a sense that you were interested in issues around social work and mental health?
Well, let me give you a brief glimpse about the beginning of Israel.
Uh-huh.
So, I'm first generation in Israel. Most of our generation, our parents are not from Israel.
Mm-hmm.
They immigrated to Israel from many, many countries in the world. Part of them came before from Zionistic ideas, with Zionistic idea, but most of the people in Israel, they came after a tremendous trauma. Mm-hmm. So we are the first generation who gave hope to these parents, mm-hmm. who suffered so much, and all their wishes were on us. Mm-hmm. So at the beginning, the founding of the country, most of us were very poor. Mm-hmm. We were very happy and we didn't feel like we are poor. But if you compare it to, according to the European CEO, the definition of poverty, we were all poor. But mm-hmm. we were very happy, and the feeling of founding a new country and having security in our country, we felt it and inserted it from our parents. So we were most of the time outside, playing outside, enjoying life, enjoying the freedom. Most of our parents, they sacrificed their future because they had to come to, and with their traumas, and to work, not according to their choices. And we had to fulfill all their dreams. Uh-huh. So they put a lot of, most of us, I'm talking about most of us, in our generation, which is a very successful generation, by the way. Uh-huh. Although we didn't have all the opportunities, but it's relatively very successful. So that's the history. I was born in Jerusalem, next to the border. And I went, unfortunately, through many wars during my life, as a child, as an adolescent, and as a soldier, and afterwards as a mother for a boy who has to go to combat that nobody will understand what does it mean, Mm-hmm. Mm-hmm. So we are still, in a surviving mode, but it's absolutely different. Israel is not the same. Mm-hmm. So this is a brief glimpse about the history.
And Yael, in terms of the history, just to anchor this a bit, Israel's founded in 1948, officially. Your generation is the first generation born to parents of immigrants. When you say they sacrificed and they didn't get to work the way they wanted, the implication is they were coming from places where they had careers or education that they couldn't apply in Israel. And so, as you say,
they stopped because of the war.
Right.
And couldn't, continue because, they had to work
right.
in order to support themselves and to support their families. So
Right.
they had to stop. Most of the people had to stop their own career and all their, dreams to aid the country.
To aid the country in building Israel.
Yes, in building it.
So you mentioned that you were a soldier. Maybe you could just share what the requirements are, what the tradition is in Israel around service as part of your training and coming to the profession that you pursued.
Yes. So being in the army in Israel, it's part of our socialization. It's not like in other armies. It's like we see, it's a people army. So people can get their profession during the army, they get the social activity during the army, and they get acquainted with many friends and getting to know young people. So it's very, very important, as part of our steps in life. So after high school, female are going to the army for about 2 years and male for 3 years. If you go through some more professions, more demanding profession, then you have to stay a little bit more. So when I went to the army, I was at the beginning like in a route to be a commander. But then, the seeds of being psychologist and treat people was there. And I moved, and I was like, we have in the army a slightly like between social work and psychologists who treat a soldier who needed some help. So that was my position during slavery. Yes.
So you got started while you were in the army in this field.
Yes, I started. I liked it. I knew that I'm going to do it. I had few options, or to be an interviewer, a psychologist interviewing to do the selection, or to do it live, practice it. But as a beginning, I was like in a route to be a commander, but then I switched. Yes, but the seeds to treat people and to be connected to people and to work with people, I think I knew it when I was very, very young.
Tell me about that.
I remember when it was 3rd grade, one of the psychologists came and did a research on us, and they asked us, what would you like to be when you will be grown up? And I remember writing psychologist. Yes.
So you were 8 years old at that time or thereabouts.
Yes.
And you already knew.
I knew that I would like to work with people. And most of my life, I did volunteering work with people and with the community while I was in youth movement. So it was natural to me. It's not something that I was thinking about.
It was in your DNA.
It's my DNA. I was kind of a pleaser person.
So what did you want to do when you imagined, I mean, if we go back to when you were 8 in 3rd grade, or just as a young girl thinking about going into psychology and mental health, what did that mean? What intrigued you about that work?
I felt like I'm going to save the world. If I treat the people and I know how to treat the people, and I will listen to them, and I will give them passion and new intention, then they will feel better and they will be able to fulfill their abilities. So I felt it, like this is my mission.
And it sounds like you also, from a very early age, had a sense of the trauma and the need for healing.
Yes, you are absolutely right. I said that I was a pleaser, but in a way, my name is Yael. It's a very popular name in Israel from that time. But my grandmother's name was Yael also, and it was uncommon to have this name. And when my mother was born, she was the only child. Her mother passed away.
In childbirth?
in childbirth.
Uh,
And she grew, her grandmother raised her. And then her father asked her to immigrate to Israel when she was 9 years old. And she had the fantasy that she's going to find, she had the dream of a 9-year-old girl that her father paid attention to her only the first time of her life, without having a mother and only a stepmother, and to immigrate to Israel and to live in a tent. It was a very hard time during the 50s in Israel. And since I was very, very young, when I was born as a girl, she named me after her mother, of course, and I took the position of being her mother. And, she passed away only recently, so I'm talking about it, and I'm doing some good for her, Supporting her. We had a very, very strong connection. But I was mothering my mother. Yeah. I was her mother in many ways, but I had it in my genes because we are 3 daughters and 1 son, 3 siblings, 3 girls and 1 son. But I was more dedicated to this position, and they were afraid from it. So I feel like, you are talking about trauma. It was part of the trauma that I was trying to overcome. This with a guilt feeling, but I'm talking about myself now, but I'm talking about the whole generation.
Right.
I have many friends who went through some other trauma with the Holocaust, and they feel the guilt of their parents, and they try to compensate. So it's not only me. I'm representing a very big part of our generation, and in particular, those who choose the therapeutic journey.
Right. So you have all this, it's not quite a blank canvas, but you have all of this space as you're building your own career, but also in this big picture of building Israel. And you are really passionate about psychology, mental health. What is at Haifa University, how do you pursue a degree in mental health? What were your options, and how did you wind up picking social work?
So it was because in the army, I did mainly social work. So it was natural for me to go and to study social work and to go to mental health track. So the first degree was clinical social work with mental health care track. So I was in mental health hospitals in the north part of Israel. And then I did the second degree in clinical social work. And in between, I did psychotherapy. We have a special degree, 3 years, School of Psychotherapy. For those who want to be a therapist, to do clinical work, they have to complete another degree. And then if you would like to add some other, specialties, like I did IPT, interpersonal psychotherapy and family therapy, but this is afterwards.
So Yael, you're studying mental health, you're pursuing clinical work. How did you get to eating disorders?
Well, it was a very unique coincidence. In Israel during that time, we didn't have eating disorder in Israel. We had only 1 small unit in the center of the country that was led for adolescent and children of adolescent, and that was led by one of the psychiatrists. And that's the only thing that we had in Israel. We are, in terms of the epidemic, we are about 15 years after America. So it was around the 90s. And one of the psychiatrists came from Boston, and she trained in eating disorder. And she came and she was doing with me, I was mainly on the field of anxiety. That's what I was doing. And crisis intervention and anxiety. And she said, and I was looking to do my PhD. And she said, why don't you do your PhD on eating disorder and we can work together?
Mm-hmm.
So I said, we have no eating disorder in Israel. What are you talking about? So she said, I'm sure we will have. Go ahead. And I remember, she gave me Dr. Vada Colling. I really liked her. She was very nice. She gave me a lot of material. She brought from Boston. So Dr. Herzog was her mentor. And I started, and then I applied to medical school. It was very natural for me. It's a special track in medical school in the Technion. I don't know if you're familiar. It's like it's similar to MIT. So I applied to medical school to do Doctor of Science, medical science. I was related, affiliated to psychiatry. And the head of the unit, he said that it's very natural for me to do it in medical school. So I applied, and the thesis was on eating disorder and family.
Interesting. So what was the thesis itself? Do you recall at this point?
Yes, it was about a communication within the family. I read Minushin, I read Palazzoli, I read the papers of Ivan Eisler from Motzli. So I was familiar with all the family, what we call now FBT. I was really expert at that. And I did my PhD on that. And then I won a grant, a special grant for my special work with the veterans in Israel, to go to the Menninger Foundation. In Kansas. It was in Topeka, Kansas.
So Yael, tell us how you got to Menninger.
During my work in mental health, one of my leading work, and was very, very important, was to found and lead a special program for soldiers who went through PTSD. I did it with the head of the unit, Professor Hefetz, and as an award for my work, I got this scholarship. Fantastic. To do some work in the Menninger Foundation and to do some work on veterans. But when I came there, I said, my PhD is on eating disorder. And this is a very special opportunity for me to learn. And they had a very big unit on eating disorder.
That's right.
And the head of the unit was Kathy Zerby. She's my very, very good friend. And she did an amazing work. And she was my mentor there. And I learned eating disorder there. And I learned family therapy with eating disorder there. And when I returned after 2 years, I was ready to found the unit, the Center of Eating Disorder. But Israel is, as I told you, we had to fight for everything. There is no money. I think it's all over the world. So I came to the head of the unit, the psychiatrist, and the head of the division. They said I would like to open a clinic on eating disorders. So he said, but we have no budget for it. So I said, don't worry, give me 2 hours of psychiatrist, give me 2 hours of social work, 2 hours of dietitian, 2 hours of nurse, and I will manage. I said, okay, I know you, Yael. Take it. Let's see what you can do. And that's how it started.
That's how it started. So you got just some percent time from members of your team to devote to helping you get this launched. But this can-do attitude and this can-do vision around building something in Israel is very much your story throughout. So you get this program set up. How did it start and how did it grow over the years?
So my mentor who teach me eating disorder in Israel, she decided to leave the country and to go back to Boston. So I was by myself. So I had to find another psychiatrist. But, the end of the story is, this is one of the biggest center of eating disorder in Israel.
Mm-hmm.
So starting with 45 patients, I remember, we had no referrals because we didn't have any eating disorder. And then when they heard that Rambam Medical Center had opened and they can give some services to, and then we had, I remember 45 patients, I had to do family therapy with 45 patients. But it was a role model for many others to open in Israel. And now we very big, treatment facilities in Israel.
Right. So now Israel has a number of eating disorder programs around the country, but the center that you founded still continues and is serving the community. Does it focus in a particular area?
I was focused mainly on FBT. And that's what we did mainly. It was before it was evidence-based. It was the project of Ivan Eisler. We learned from him. It was evidence-based by his research, but it was not later on. That's what we did, and it was very, very successful, very much. Of course, multidisciplinary model, as you all know from all over the world, but we did, and then we added CBT, we added DBT, we added IPT, all the evidence base, and we sent people to Christopher Furban to learn CBT, and so we enrich ourselves. I send many colleagues of mine. I was leading this center for 25 years, and now it's even flourishing since I left. We have day treatment there, and so it's a very big one and known one.
So you've been at this for a while and really helped build the field in Israel. In the course of that time, I'm sure there were many observations that you made. I know there was a lot of clinical work and research work that integrated in ways that informed your own ideas about an understanding of eating disorders. How did you get to your big idea? What's the big idea that's on your mind today, and how did you get there?
I was thinking about the modeling law that I was very active in. It was very pioneering in Israel, but I decided to focus on something that I feel that it's part of me. While treating these severe cases of anorexia, I was observing the same syndrome that all the people who works with eating disorder observe, the revolving door syndrome. That they hospitalized, I'm talking about the severe cases. They return to the center and then they get outpatient, but they cannot cope outside. They need some skills. They don't get enough support from the family surrounding. It's not that the family is not good, but they needed more tools, coping tools, in order to manage and not to go back to the symptom immediately, like many of them. And I understand that they needed like transitioning period in a home-like surrounding. At that time, only mental health in Israel, according to the law, got a special support covered by the government, but not eating disorder. Eating disorder, it was not mentally ill. It's a disorder. That's why they didn't get this basket. We call it basket of rehabilitation. I had to fight in order to change the law and to include eating disorder within the law. But in order to do it, I had to provide some new projects. So we have in Israel, in the Social Security, there is a special department that we call it a special department for a special project that the government is not covering. They give a lot of money if I succeed. I applied. If I succeed and it sounds reasonable, they pay me for a trial period, 3 years. I got 3 million shekels, which is a lot. About $1 million. for a 3 years pilot, and what we created, it's not similar to the transitional house in America. In America, it's connected to the hospital, and the people who lead this, it's professional people, like psychologists, psychiatrists, and they don't feel the same sense of home-like. So what we would like to create is something different from that. And it was one in the center led by Eitan Gur, and one in the north that I created. And it was a house. I had to find a house. I had to find a nonprofit to run it. A nonprofit, how do you call it?
Host it or sponsor it?
Yes, to sponsor. I had to give the money, but to lead it. And I had to get an approval from the Ministry of Welfare, Ministry of Health, because the condition that the Social Security gave me in order to give me this fund is that the government promised that if it will be successful after 3 years, they will cover it. And they will change the law, and they will continue giving them the basket of rehabilitation like they give to psychotic people. So we start this trial. So it was outside the hospital, in a communal part, not so stimulated, not to be. And they had to go, the 14 girls, it was above 18, between 18 to 30. They had to get accepted. They had to be asymptomatic, like after hospitalization. They had to keep BMI of minimum 19, and they had to eat supervised. So we had a mother house, we had director, we had nutrition, and we have counselors. And the counselor did most of the work. They were like friends. It was student of social work, student of nutrition, and student of psychology. They gave them the support, like a friend kind of support, 24/7. And they had to stay there to find work, studying, volunteering, whatever, not to stay at home.
So the residents had to do that. The requirement was that they were engaged constructively in work or studies.
But they had to keep the balance of at least BMI 19 and not to be symptomatic. Of course, most of them become symptomatic, but they had 3 levels of warning before they. So it became very, very successful. After 3 years of this trial, it was approved by the government.
What a huge success.
Yes, and now in Israel, I don't think you have it anywhere in the world. If you will succeed to get into rehabilitation basket, you get funded with about $3,000 per month to get your rehabilitation process by the government. It's very, very unique. So if you want to study, or you want to find a new job, or you need housing, or you need supervision of nutrition, or you need counselor to supervise you while you are. So there are many stages now, not only this rehabilitation house. So now we have, because it was so successful, the government agreed to open another 2. So now we have 4 rehabilitation houses in Israel. In the center, 1 in the north, 1 in Jerusalem, and 1 in Beersheba, which is the south. So we can cover the whole country. So it was a very, very unique project that I think, can give an example to many other countries, talking about severe cases of eating disorder, the whole continuum of eating disorder. It doesn't mean only anorexia, and to give hope to them and to their family. Because when you enter this vicious circle of being in I don't like even to term it chronic, because I think you label it when you call them to chronic, because I know personally many who were in a very severe and enduring cases that now are okay. They live full life. So we have to be optimistic. And that's the vision that I had, that we had to give them the hope that they can do it. They need these tools because the world was overwhelming for them.
Right. So, Yael, this is a residential program, a residential house. Individuals with eating disorders come there. They've been in intensive treatment, so they're in a pretty stable space when they move into the home. How long can they stay? And do some people stay for years? Is it a time-limited commitment? How does that work?
So they get the treatment for their eating disorder, not in the house. They get it in some other places like Rambam Medical Center or some other places. At the house, they get only the skills, the coping skills, how to manage life. Okay. So they have many groups, and they are supervised, etc. They can stay there between 1 year to a year and a half. And then after this stage, there is they're going to live by themselves, and it's covered by the government also. And the dietitian and social work come twice a week to see them and to see how they're doing. And then after this stage, they are going to live by themselves. So that's a journey. They don't need more than that. When I wrote the program, I intend to give them only 1 year, but we found that it was not enough. We created another stage, which is it's next to the house, the rehabilitation house. They live around this area, and the social work and the dietitian of the house comes to visit them. And they can come. It's like a community house. They can come during Shabbat for Shabbat dinner. They can come and visit. It's like a house, and they live by themselves.
There's an economic thread to the story that also is associated with quality of life, right? So it's clearly better for somebody to be supported in a continuous way and build these skills and community and stay out of the hospital versus going into the hospital. Maybe they cost about the same, but clearly quality of life is better. And if it costs less, even better.
Of course, the government, that's what they were thinking about the economic part, and it makes sense. But what I was thinking is about there is a big debate about how much to invest in treatment with this kind of patient. And I felt that they deserve what they need in order to have a better quality of life and to be optimistic for them and for their family. And it found to be successful. So we have to be optimistic about these cases.
That's right.
Not to give up.
That's right. So when we think about this innovation that you've set up in the world of global mental health, we trade ideas and we learn from each other. What would you say to eating disorder professionals in other countries about what's really important about making this model work, and what are some surprises, what are some challenges that people should keep in mind if they think to themselves, wow, that sounds like a really good idea. I'd like to try this in my hometown.
What I can say is but this is my point of view. You have to look at people as a people, according to their needs. We are not the same. And everybody needs something else. And some people were born with a lot of qualities, but they are very sensitive. And life is too hard for them. And they need more support and more coping skills. And we should give them. We should enable them to go through life with more strengths. And that's our role as mental health profession. And not to give up by saying, you are 10 years suffering from eating disorder, so you have no hope. This project gives hope to families and patients to believe in themselves and to do things slowly, not to move, forward with the same rhythm like everybody, but to be in the routine of life. So that's my message. And the more centers like that, rehabilitation center, the better, because when we talk about mental health in general, rehabilitation is the key words. To go back to the community and not necessarily to get cured, but to live a healthy life. That's it's a difference between cure and remission. So you can live with the illness, but live good.
So that's a profound message, right? To remind all of us that there's quality of life at all stages of and all different ways of living this life. And everyone lives with some, let's say, some burden of some sort. And for our eating disorder patients, for them, the challenges in life are maybe shaped significantly by their eating disorder symptoms, but they can live a high quality life, is what you're saying. And we need to focus on quality of life. So what do you see in terms of engaging government officials? You had to really, you're not just building a program, but you're building a program in partnership with government support and government engagement that is pretty much a requirement around the world to build a program like this, right? Maybe in some places, something like this can be set up as a private pay opportunity, but that will only be for a very small number of people. To make it accessible to the larger population, we need government engagement. How did you make this initiative make sense to the government decision makers? And what would you say to people who are thinking about doing this in some other country? What do they need to be? How do they need to frame it? How do they need to be presenting this in a way that's persuasive?
In two ways. One, the economic one, because the government pay a lot of money. And, in Israel, it's actually public health treatment. The government pay a lot of money and for health care. So one of them is economic. And the other one is the philosophy of, getting, into the community in terms of mental health, not to keep them in the illness zone, but to bring them back into the community. And this is also economic because they are better people for the country.
They're better able to engage and be engaged citizens.
What we need now is another rehabilitation house for those in a very, very, very severe cases, like the BMI 12, 13, that they can't stay in the hospital forever. And they needed a special rehabilitation house. This is another thing that somebody else will do, not me.
So you're ready to pass the baton and champion the next generation. In that spirit, as you look ahead, Yael, what do you hope the next generation will pick up and run with?
Well, it's very hard for me to separate from the situation that we are now, because first of all, we need democracy in Israel. And when you have a democracy and free country, you can do everything. So that's my message.
Yeah. So Yael, as you look back over your career and really being a pioneer in Israel in building the field of eating disorders, developing programs for individuals suffering from eating disorders, working on policy fronts, you briefly mentioned your work, and I just want to underscore the efforts that you put forward to around policy and eating disorders and changing regulations around the modeling industry, for example, in Israel in very constructive ways, building these rehabilitation homes that are really a model for the world. You've contributed so much to the field. And as you look ahead to those who you are mentoring, what are some of the exciting things that you see that they're doing?
Well, I think the main effort now should be targeted into prevention, elementary like this. We have the elementary prevention, the secondary prevention, and the third, I think we have to target the prevention from kindergarten, from first year, giving a lot of instruction and support to mothers, to first child mothers, and then secondary among adolescents, to do a lot of prevention program among adolescents, and to focus on parents, because parents are our, we are internalizing their messages. So
you started out talking about your own experience of internalizing the message from your mom and the ways in which our social connections are so foundational in terms of who we are and our experience of place in the world. And I think that comes through in terms of the work that you've done and the strategies that you've implemented around context, social context, and interpersonal relations, and how foundational they are to our health. So thank you very much for joining us today. Congratulations on this pioneering work that you've done in Israel and that you have shared with so many of us in so many places around the globe. You've really contributed dramatically and in very important and substantive ways to improving the quality of life for people who have eating disorders. Thanks.
Thanks very much for you for choosing me to be part of this amazing project. Thanks, Kathy.
Pleasure.